If you or someone in your family is living with COPD, you already know how difficult breathing can become. Simple activities like walking, climbing stairs, or even talking for a long time can feel exhausting. But here's something many patients don't realize: physiotherapy can play a very important role in managing COPD and improving daily life. In this video, we'll help you understand how physiotherapy supports COPD patients and what you can do to breathe better and move better. COPD, or chronic obstructive pulmonary disease, is a long-term lung condition where airflow to and from the lungs becomes restricted. It usually develops over many years and is commonly seen in people with a history of smoking, long-term exposure to pollution or dust, repeated chest infections. COPD doesn't just affect the lungs. It affects energy levels, daily activities, sleep quality, confidence, and emotional well-being. Medicines are essential in COPD management. They help reduce inflammation and open the airways. However, medicines alone cannot strengthen weak breathing muscles, improve endurance, teach efficient breathing techniques, reduce activity-related breathlessness. This is where physiotherapy becomes a vital part of COPD care. Physiotherapy focuses on improving how you breathe, move, and perform daily activities with less discomfort. Benefits of physiotherapy for COPD patients: improves breathing efficiency, strengthens respiratory muscles, reduces breathlessness during activity, improves stamina and endurance, helps clear mucus from the lungs, reduces hospital admissions and flare-ups. At O Fine Physiotherapy, treatment plans are customized based on lung capacity, oxygen saturation levels, age and physical condition, daily lifestyle and activity levels. 1. Breathing exercises. Techniques such as diaphragmatic breathing and pursed lip breathing help slow down breathing, prevent air trapping, improve oxygen exchange. 2. Chest physiotherapy. Special techniques help loosen and clear mucus from the lungs, reducing chest congestion, risk of infections, breathing difficulty. 3. Exercise training. Carefully monitored exercises like walking, cycling, light strengthening. These improve endurance without overloading the lungs. 4. Posture or mobility training. Correct posture allows better chest expansion and easier breathing. All these techniques are introduced gradually and safely under professional supervision. Yes, and avoiding physical activity often makes symptoms worse. The key is the right exercises, the right intensity, expert supervision. Physiotherapists continuously monitor breathing rate, fatigue levels, oxygen saturation, and recovery. Here are a few simple habits that can make a big difference. Pace your daily activities. Avoid rushing movements. Exhale during effort, standing up, climbing stairs. Maintain correct sitting posture. Stay physically active within comfort limits. Seek physiotherapy guidance early. Living with COPD can be challenging, but with the right care and physiotherapy support, many patients lead active and fulfilling lives. At O Fine Physiotherapy, the focus is not just on treatment, but on helping patients breathe better, move better, and live better. If you found this video helpful, do share it with someone who may benefit from it.